You've seen the recent headlines, haven't you? Serena Williams said she lost 31 pounds using a weight loss medication. But she's not alone. Surveys, in fact, showed that around 31 million US adults have tried one of these medicines. They're turning to a new class of medicines, Ozempic, Wegovy, Mounjaro, for weight loss. But here is the big question. Do they really work? Are they safe for you? But more importantly, are they right for you? I'm Dr. Kiat. Let's go heart to heart. As a cardiologist, I recommend Ozempic and Mounjaro to many of my patients. A lot, in fact, they don't have diabetes. This is because losing weight does a lot more than lowering or improving their blood sugar and blood pressure. It helps my patients breathe easier. They sleep better and move with less pain. And when patients can move more comfortably, they become more active. And being physically active is the single best thing they and you can do for your heart health, to reduce cancer risk and reduce the risk of dementia. But before we start, let's clear this up. Just a few terminologies here. Ozempic and Wegovy, they're the same medicine. It's called semaglutide. Ozempic is for diabetes and Wegovy for weight loss. Same thing, Mounjaro or Zepbound, they're both tirzepatide. One for diabetes, the other one for weight loss. Think of it like the same actor playing two roles, different names, but same person. And here's how I explain Ozempic and Mounjaro to my patients. Our gut makes natural hormones, and they're called incretins. They control appetite and blood sugar. One key incretin is called GLP-1. Ozempic is called GLP-1 agonist. The word agonist just means it acts like the natural hormone itself. Think of it as having a spare key or duplicate key that opens the same lock. When the lock opens, your digestion slows down, you feel full quicker and for longer. So you eat less and your weight starts dropping. Blood sugar will improve too, especially if you have diabetes or pre-diabetes. Mounjaro or tirzepatide goes even one step further. They're called a twin cretin because it copies not only just GLP-1, but also another incretin hormone called GIP. That double action often means more weight loss than Ozempic. So in simple terms, both medicines, semaglutide and tirzepatide, cut appetite, help with weight loss, but Mounjaro has the extra power. So how good are these medicines for weight loss? In clinical trials with people who didn't have diabetes, Ozempic, when they used it for 1 year, about 70% of them lost at least 10% of their body weight. And more than half, or approximately 1 in 2 of them, lost 15% or more of their body weight. And around 1 in 3 lost 20% or more of their body weight. With Mounjaro, the results were even stronger as expected. 70% of the participants lost 15% or more of their body weight over a year. More than half lost 20% or more, and about 1 in 3 lost 25% or more. That's the kind of weight loss used to be seen only with gastric sleeve or gastric banding surgery. More women than men have used Ozempic and Mounjaro. And in clinical trials, women tend to lose more weight, about 5 to 6% more than men. So what are the common side effects? The most common side effects are gastrointestinal side effects. They're like nausea, constipation, diarrhea, and sometimes vomiting. And these are common for both Ozempic and Mounjaro, but are usually quite mild and transient. And that's why we do tend to up-titrate these medications over 4 to 6 months. Symptoms, as expected, are milder with Ozempic. Both may increase the risk of gallstones and rarely pancreatitis. So if you have had pancreatitis, gallstones disease, or have very high triglycerides level in your blood, your doctor may not recommend these medicines for you. People often ask me also about side effects beyond gastrointestinal or stomach upset. One is eye problems. In some diabetic patients, rapid sugar improvement can temporarily worsen existing diabetic eye disease. It's not the medicine hampering the eye, but due to sugar dropping too fast. Another is hair loss. That can happen with rapid weight loss with any cause, just like after major surgery or a crash diet. And this is usually temporary. So the big question is it really for you? Ozempic and Mounjaro can be especially helpful if you're overweight and have cardiac and metabolic risk factors like type 2 diabetes, high blood pressure, sleep apnea, heart and kidney disease. And who might not be suitable? These medicines definitely are not for everyone. If you have certain rare conditions, like a family history of certain thyroid conditions, if you have had pancreatitis, troubling gallbladder conditions, you're probably not a candidate. They are also not meant for people with type 1 diabetes. And I don't recommend these medicines if you're not ready to change your lifestyle, like eating healthier, moving more, managing stress. Without that, chances are the result wouldn't last once the medicine stops. So how long do you need to take it? The medicines seem to keep the weight down for as long as you stay on it. For many patients, especially those with diabetes or heart risk, staying on the medication long term may give the best protection. Quit Ozempic and keep the results? For many, the answer is yes. The real-world data is quite encouraging. A major U.S. study found that if you stop Ozempic or Wegovy and stick with healthy lifestyle changes, most don't regain the weight. In fact, over half, 56%, kept all the weight off even 12 months later, and 36%, over one-third, actually kept losing weight after stopping. Some doctors, including myself, use these medications selectively as a 3 to 6 months kickstart, alongside lifestyle strategies for healthier eating, regular exercise, stress management, and better sleep habits, then taper off the medications or the medicines while continuing to focus on lifestyle. And I'll give you 2 examples in a minute. I've seen dramatic results in my own patients. Take Gil, 54, 9 weeks on Mounjaro, 22 kilos down, blood sugar from pre-diabetic to normal, blood pressure back to healthy without medication, a total reset. And James, 72, who went from barely walking 50 meters from his heart-weakening condition to exercising daily after losing 17% of his body weight on Ozempic. His heart marker, which is called NT-proBNP, improved by 90%. His quality of life perfectly transformed. But there are some natural strategies that can stimulate your own GLP-1. For example, fiber. When soluble fibers from oats, legumes, fruit, and vegetables are fermented by gut bacteria, they produce short-chain fatty acids that stimulate GLP-1 release in the gut. Protein, especially whey protein, can significantly increase GLP-1 secretion in the gut and help with appetite control. There are also healthy fats, such as monounsaturated fats from olive oil or extra virgin olive oil, nuts, and avocados, which slow down gastric emptying and promote GLP-1 release. The polyphenols present in tea, coffee, and berries may also increase or prolong GLP-1 activity in the gut. Exercise, both aerobic and resistance exercise, have been shown to enhance GLP-1 secretion and sensitivity. Prebiotics and probiotics, the emerging evidence which showed that certain prebiotic fibers, like pectin in apples and citrus, inulin from chicory root, garlic, onions, leeks, asparagus, and beta-glucans in oats, barley, and mushrooms, and galacto-oligosaccharides, or short for GOS, from legumes, as well as probiotics, can enhance GLP-1 release through gut microbiome effects. And some patients ask me about moringa, and indeed early studies suggest moringa may help boost GLP-1, but the effect is probably quite weak, and the evidence is still very limited. So yes, Serena Williams' 31-pound weight loss is headline news, but the real story is how these medicines can change many lives, especially for overweight people with cardiac and metabolic risk factors. And here is the catch. They work best when combined and paired with lifestyle changes, healthy eating, regular movement, stress management, and good sleep. Medicine is the spark, but lifestyle is the fire. Sometimes I use them for my patients as a 3 to 6 months kickstart, but long-term success always comes down to lifestyle. If you want more evidence-based, heart-healthy strategies that really work, hit subscribe and join me. Let's walk this journey together. I am Dr. Kiat. Let's keep going heart to heart.